This is a recording for the Occupational English Test held in Jeremiah International Academy, Calicut on 6th of June 2023. The candidate is Ashna K and your candidate number is 200273524. The interviewer is Adira, the card number is 5 and the profession is nursing. Good morning.
Good morning.
My name is Adira. Can you say your full name for the record, please?
Sure. My name is Ashna K.
Alright. What's your candidate number, please?
My candidate number is 200273524.
Okay, thank you. You are taking this test as a nurse, is that correct?
Yes.
Thank you. Can I see your identification document, please?
Sure. Here it is.
Alright. Thank you. I'm going to be working with you for this test. There will be one question followed by a role play. Remember, this is a test of English, not of your professional knowledge. Please speak naturally. Do you have any question about this?
Nothing.
Fine. The warm questions are not essays. It's just chance for us to get used to each other's voice. Well, we'll talk for 2 to 3 minutes. I would like to know about your professional background. So, how long you have been working as a nurse?
I have been in this profession for the last 3 years.
Alright. So, why did you decide to become a nurse?
Well, nursing is a noble and service-oriented profession. Apart from that, in this profession, we will get the opportunity to interact with the people and be a part of their care.
Alright. Tell me about a usual day in your job.
Oh, that's a good question and I'm happy to share my experience with you. Usually, my day starts at 7:30 a.m. by inventory checking and updating the crash cart. After getting the allocated patient, I will take handover from the previous duty staff. During that time, I will maintain a good interpersonal relationship with them. Then I will carry out all the patient needs, including the doctor's order. Finally, the day ends with the proper documentation by giving a handover to the next duty staff.
Alright, thank you, Ashna. So, now let's move on to the role play now. I will take the part of the patient or perhaps a relative. You will take your professional role. The role play will last for 5 minutes. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any question?
Nothing.
Okay, you have up to 3 minutes to prepare the role play. You will start the role play after that. I will let you know when the 3 minutes time up and you can ask me if there is anything you are not sure about and you can make notes on the play card if you want. Here is a pencil for making notes. And you can look at the card during the test, but you must return to me at the end of the test. This is your information for role play. It's role play number 1 for the profession nursing. Please start preparing now. Okay, so you can start your role play. Here's your 5 minutes time for role play. Starts now.
Good morning.
Good morning.
My name is Ashna. I am one of the registered nurses in this community health center. Today I am here to help you. While looking at your face, you seems to be a little anxious. Could you please tell me the reason behind that?
Yes, nurse. Few days back, I had chest pain and consulted my GP, so he referred me to the center for an ECG.
Oh, I'm so afraid to hear that you had chest pain, but nothing to be alarmed about it. Before proceeding further, it's better if you could tell me your name and age.
You can call me Adira and I'm 50 years old.
Alright. How do you feel now?
Currently, I don't have any chest pain, but I'm a little bit worried regarding the procedure.
Oh, it sounds good that you don't have pain currently, but I can sense your worries about the procedure. And can you please explain so I will be able to help you out?
Yes, nurse. I'm concerned as I never had an ECG. I'm not quite sure what it involves.
Oh, thank you for sharing your anxiety with me. I want to assure you that ECG is a simple diagnostic procedure which will help to identify your heart activities. So now shall I explain regarding the ECG in detail?
Sure, nurse.
First of all, for the procedure, I request you to uncover your dress to take the test, for which there will be a dressing changing room. And the test will be taken on a lying position. Secondly, the leads will be placed on your chest and both extremities. Are you following me?
Yes, nurse.
Oh, finally, the results will be placed by the machine within a few minutes. How does that sound?
Yes, nurse. The ECG procedure sounds straightforward. But nurse, I think you will be discussing the results with me, right?
I know you are eagerly waiting for your test results, but I'm so sorry to tell you that doctor is the right person to reveal the result and he will discuss it with you.
Oh, all right. If you could make me to know the results at the earliest, would be grateful.
Alright, I respect your opinion and I will make it as soon as possible. I hope you will agree for that.
Yeah, I would like to know whether the procedure is painful.
Oh, this is a common question from every people who is undergoing this procedure. Actually, it is a painless, non-invasive procedure and hardly it will take 2 to 3 minutes. But some may experience a slight discomfort while applying or removing the electrodes. I hope you can understand this.
Yes, nurse. I hope the test will disclose my exact problem.
Well, Atira, actually the function of the ECG is to measure your heart rate, irregularities and palpitation. However, if you found any variations in your test result, it is necessary to undergo further investigation based on the doctor's order. Is that okay with you?
Yeah, sure.
So, before the procedure, it is imperative to remove your all jewels and electronic gadget. Are you into?
No, nurse. I'm not carrying any of this.
Oh, good to hear that. It's nothing because these things can make some false changes in your ECG diagnosis. That's why I asked you.
Oh, that's okay, nurse.
No worries. Fine, Atira. Is there anything still worrying you?
No, nurse. You clarified all my doubts.
Well, I'm happy if you could sign the consent for the procedure. After that, we can begin the ECG.
Sure, nurse. You must please start the procedure.
Thank you for your consent and cooperation. Anyway, throughout the procedure, I will be there with you. If you face any difficulties, you can interact with me. I will respect your privacy and urgency as well.
Thank you, nurse. That's the end of your OET speaking session.
Thank you.